Today we're being joined by Dr. Sobel, his medical health officer from out of La Ronge, and he's been boldly going where nobody goes before, is finding new ways to heal our people, and he's looking for help, and hopefully it comes our way in very short order. But we thank you, Dr. Sobel, for taking care of all our questions and concerns that we've had through our pandemic. But any reports that you have on our COVID or else other issues in northern Saskatchewan, we welcome your thoughts and perspective.
Well, thank you very much. As I've told you before, this is the most enjoyable part of my week, and I'm very happy to give you any reports that I have. We have a meeting of our whole team every Wednesday morning, so I ask the nurses for updates about COVID and any other issues they wish to speak about. So COVID activity has been very quiet, and now we don't track COVID other than if it's the cause of somebody who died. That's what the province now wants us to report, nothing more. So we don't have that kind of information that we used to be able to give either on a daily or a weekly or a monthly basis. So what I can tell you is that we're now also getting updates in what they call surveillance and typing of the virus, and it has just exploded into so many different variants that we keep seeing new ones come up on a regular basis. The information about the variants now looks like a starburst, because it started with one and then it expanded into the Omicron series, and now the Omicron has divided into several other variants. I read something the other day that I certainly have been thinking about for a long time, and that's the fact that the developing countries, which were supposed to be getting the capacity to make mRNA vaccines so that they could have vaccine production in their own countries, has not happened. The developed countries that said they would put millions of dollars into making this a possibility never did that. They just kept the ideas and the patents and the vaccines to themselves. So that is a reason we see more and more variants, because the more the virus is in circulation, the more possibility there is that it's going to mutate and come up with new variants. So if we really had a global view of the pandemic, which we should all have, except our political system doesn't really promote that at all. Governments want to be reelected, so they immediately think about their own jurisdiction and what they can do to bamboozle the public to think that they're doing the right thing. We're still at the mercy of this virus, which is circulating. Even though the World Health Organization said it's no longer an incident of worldwide concern because of the low prevalence of it now, it's still certainly a virus that's in circulation. And we keep hearing new things about long COVID. Nobody still knows, why it happens to some people and not others, why it affects some people in one way and not others. But, what I've read about it is that long COVID can be a really disabling illness. And so whatever anybody can do to try to protect themselves against that is quite a valuable thing to do. And I know that in the north, we've had less uptake of the COVID vaccines than other parts of the province, and Saskatchewan hasn't done very well in total. So let's just hope that people are, being careful. I'm still one of the only people who wears a mask anytime I'm indoors where there are other people. So, even on my holidays, I was wearing a mask, and maybe one or two other people out of 100 or so would be wearing one. But an N95 mask not only helps reduce the spread of, or you're getting infected with COVID, but also from influenza and rhinovirus, which commonly causes colds, or rotavirus, which causes diarrhea. So I certainly still would recommend getting the updates on those viruses whenever they're available to you. The other thing that I'd like to mention, and it's going to be no surprise, is that we are still seeing so many new cases of HIV, syphilis, chlamydia, gonorrhea, and I'm trying to work on a public campaign to speak to our communities. I don't know whose community is going to be, because originally this was going to be a project with NIFA and Indigenous Services Canada and Northern Medical Services. And now I don't know whether SHA wants to become involved or not, but basically it's just repeating the message that we've been giving out before, that if you have a sexually transmitted infection, you should be seen by your health center, because all of them are capable now of being treated. Even HIV can be appropriately treated very simply with like one medication a day, and it can result in the level of the virus getting so low that it's called non-detectable. And if you're a person who's infected, has that low of a viral load, they are not even going to be able to infect others. So, that's a great advancement. And so people can live a normal life for many, many years. We're seeing also, though, a huge increase in the number of syphilis cases, and syphilis used to be thought of as an ancient illness, which we've gotten rid of, and it's come back with a vengeance. So we need to have people be aware of that as well. And that's the most acute problem that we've got to deal with, other than tuberculosis, which isn't as widespread in the communities as sexually transmitted infections, but we still have a significant number of people who either have active tuberculosis or who have latent tuberculosis. And in either case, treatment can be given to them to eliminate that germ from people's bodies, so they won't pass it along to others. It takes a long time. You can't treat it easily with just a week or two of medications. It can go for many months, but it can be highly effective so long as people don't miss their schedule of treatment. So one of the things we have to do is make sure that we can follow them. There's something called DOT, Daily Observed Therapy, which has been very effective. And we can either use a healthcare service people to watch somebody take their daily medication, or we can have a trusted member of the community or family do that. And so long as people are very vigilant in taking those medications, they should be able to just eliminate that illness. TB can go anywhere. Usually it's in the lungs, but it can also spread to any part of the body. And when it's widely spread, it's called miliary TB. The worst things that you can get from it would be like a TB meningitis. It affects the lining of the brain and can result in death. Death from TB is extremely rare, but I know of at least one death that we've had in Saskatchewan this year from TB, and any death is unacceptable. So we're also working on that. We got problems with, if we test people and they need to be treated, then where do they go for treatment? And just recently, we've arranged to have a portable X-ray machine go to the community of Sandy Bay, which has several TB cases. And that portable X-ray is going to allow us to see if there are others in the community who have signs of TB on their X-rays. It's pretty easy to discover. And fortunately, there's a person who had a portable X-ray machine who's going to bring it up for a while. It's amazing that we don't have more opportunities to have access to that kind of equipment. But we're in the north, in marginalized communities, and politicians think more about big cities and who's going to vote for them than rural, small northern communities. Although some of you have voted for Saskatchewan Party MLAs, you'd think they would take that as a sign that maybe they should pay more attention. I take it as a sign of psychiatric, widespread community psychiatric disturbance, but that's my view. I don't know what day it's
There's a
Saskatchewan.
lot of that going on all kinds of things.
Pardon?
There's a lot of that going on and all kinds of things.
I know. What a world we live in, huh?
Oh, God.
Well, I
We're
don't.
being recorded, so I can't see what I was thinking.
Oh, we're being recorded, and I guess Rick's going to send us to the Minister of Health, and you'll no longer be seeing me on these calls.
No, this is for history.
Yeah, okay. Now I see there are 4 participants, but I only see 3. Who's the 4th?
Chris never shows his face.
Never showed his face, but I don't even,
He's there.
Eating.
Oh,
You're
Chris, I see. Oh, it's Chris. Yes, I can see now. Well, now there you are, Chris. What are you eating? We're all interested in what you're eating because if it's really good, we'd like some of it.
Wheat thins. He's
Wheat
muted.
Thins.
You're muted. We can't hear you too.
Chris, are you muted because you're eating wheat thins or you don't want us to know anything?
Yeah, that's what I said.
Yeah, she nailed it.
It was a contest and I won. Now I get a package of wheat thins from Chris.
Well, Chris, you heard the verdict. You owe a package of wheat thins now, and there is a time limit.
Yeah, I don't want expired ones.
What I'll do is I'll grow some wheat.
Oh, that would
Make 'em.
even be better. I need some for
No,
my
I'm
chickens
actually-
anyway.
I'm driving, so that's why I'm just not showing myself, but I am listening.
Well, you're driving, are you? I didn't see anything that looked like you were driving. I noticed you were in a vehicle, but it looked as if you were stopped. So if you are driving and you're eating wheat thins at the same time and you're on this meeting, I'm calling the RCMP immediately. I'm going to use my
I think
GPS
Brenda's no
to
longer on the
locate
call.
you, and you can join us from the confinement facility for the rest of the meeting.
Well,
Let's
that's
see, other than those reports, I don't have anything that is that unusual. We get reports now, by the way, every week of hospitals which are overcrowded or extremely overcrowded, and other than Lloydminster, which is kind of overcrowded at the moment, the Saskatchewan side. Everything, or is it North Battleford? Oh my goodness, my brain. Where did I leave it? Sorry? What
He
was
and
that?
Rye are playing dragons.
Anyway, our hospitals have been pretty good in terms of, not having to close emergency rooms. I haven't heard anything about that for a while. I should let you know that Dr. McKinney is in Halifax. Her son is a serious kayaker, and so he's participating in kayak competitions, and apparently yesterday he came in 3rd place in his group, so he was happy about that.
That's good.
And I always find it really inspiring that Dr. McKinney takes the time to always be with her kids when they've got a competition or some other event like that, so she's a really good mom. And that's always great to hear. She will be in La Ronge later this month because one of our staff, who's the clinic manager at the medical center, has worked for Northern Medical Service for decades, and she's going to be retiring soon. So Rhonda is her name. So there will be a big gathering for that. And both Pat, I don't know, do you ever speak with Pat at the Northern Medical Services office? She's Dr. McKinney's assistant.
No.
No, okay. Well, if you just want to take the short drive to La Ronge on that day to, get a sandwich or something,
The short drive.
A little John.
Shitty road.
I'll be happy to pay 30% of your gas expense. How's that?
Okay, I'll take the long way around.
Oh, via Northern Ontario. Okay. So I'll let you have the floor now that I've rambled on for so long.
Well, any questions for the doctor? Perhaps your report was excellent.
I did have a question that I'd sent you an email on about a month ago during the evacuations we had. We had a quadriplegic person that we needed to evacuate out of the community. And at the time we felt like during this summer of dry and fires and smoke in a community with one road access, that it might have been wiser to have him in a facility for the summer than to move him back and forth. We moved him twice.
Right.
And fortunately, the second time he only had to go to Isla Cross.
Mhm.
But the first time he had to go to Leask. Because, moving him into facilities, it's not like he has to have special transportation and everything.
Sure.
But I was suggesting respite care, but I'm told that respite care is only available for 2-week stints.
Uh-huh.
So I spoke to Dr. Nabuka, and he suggested I speak with you because once they leave the community, they're in your district, your provincial jurisdiction. If there could be some lobbying, some advocating for a solution to this sort of scenario, particularly for northern people.
Mhm.
If they have to, like, if we're seeing a really bad season for a longer than 2-week period of respite.
Yes, well, I think that makes perfect sense. Now, is that person amenable to staying out of the community during the fire season?
We pretty much had them convinced, so him and the family, and that we could put his family members in accommodations close to where he'd be,
Okay.
which would make it easier for them. And the reassurance that yes, he will get to come home at the end of the fire season, or when we are assured that it's no longer a danger.
Mm-hmm. Now, I wonder, would this be something that could be this request put in writing with some type of official signatures on it, like the premier or Justin Trudeau or someone from your community? I'd be certainly happy to add my name to that and to try to advocate for it as much as I can, because it makes perfect sense to me.
Okay, so what I'll do is I'll draft up a letter. I'll get our health director to sign that, maybe Dr. Nabuka to sign it as well, and yourself.
Mm-hmm.
And we could put it to NIFA. Yeah, NIFA would be then, and then we could put it to ISK to put pressure on the province. Would that make sense?
Well, what I was thinking of was maybe I could bring it to the attention of Dory Goodday, who's the executive director and for the integrated north, so that's northeast and northwest, and also perhaps to Andrew McClatchy, who's the VP responsible for the north. So I'm thinking that those two might be able to actually make something happen. So I would address it to them for a start.
Okay, I'll need their. I'll give you my email address.
Okay.
And then you can give me the spelling of their names and
Okay.
maybe some email contacts, maybe.
Oh, sure. So please go ahead. Or do you want to send that by email?
I can send it in the chat if you can see the chat.
Let me see the chat.
Toolbar at the bottom.
Yeah, just a sec. Here's the chat. You are chatting as a guest. Well, how about that?
Okay, I'm gonna send it right now.
Candace Paul at ERFN. Is that what it said? Gotta put my reading.
Candace.Paul.
Yeah, Candace.Paul at ERFN.net. I only know one other person whose last name, well, I know two people whose last name is Paul. There's Connie Paul is a nurse I worked with when I worked for the NISCA in Northwest BC. And her brother is Lawrence Paul Ukes Wellington, who has become a very famous Indigenous artist. And his artwork now, his paintings go for dozens of thousands of dollars. I don't know if you.
That would be nice. My husband is also an artist. You can see one of his paintings behind Rick.
Behind Rick. Oh, I've noticed that. Yeah,
That's one of his paintings.
one of his paintings. Well, you might let me know if you have any others that he would be willing to unload for an unreasonably high price.
I'll let you know. There's one available right now.
Okay, all right.
Because yeah, we're getting prints made of it, so it'll be a little bit before it becomes available.
Okay. There you go. Nothing like
Doing
Nothing
deals on
doing-
meeting.
nothing like doing a bit of capitalist interchange while we're on this call.
Do you get?
Trading. This is called trading. It's an ancient.
Yes, it is.
an
And do
ancient
you
art.
have are you able to receive photos on your cell phone?
Yes, I can.
Then give me your cell phone number and I'll send you a photo of the painting.
Okay, my cell phone number. I'm gonna now, let's see, meeting 2. Here you go. Does everybody else want my personal cell
course I
phone?
do.
I'll send it to everybody.
Definitely.
Is that all right?
Yeah.
Yes.
Okay. I especially like getting called at 3 or 4 in the morning.
Yeah, that's for sure.
Early in the morning? Well, I'm just going to send it to you right shortly.
So,
And just take, and there'll be several photos because there's some close-ups because it's a very large painting.
oh my gosh. Okay.
Worth if you can get one from Marius Paul, you're in the good books there, Dr. Sobel.
Okay.
Right.
Well, you know, wherever I've lived, I try to collect the art that's made by local artists. I like to support the arts. So I have too many pieces of art.
Never
I
have too many pieces of art.
You know something? That's what I keep thinking.
Yeah.
It's like not having enough beaded work.
Well, the
Well-
best beaded work I've ever had is, I don't know if I ever showed it to you, but when I was working at Isla Cross as a family doctor, a woman who was a patient in Beauval came in one day wearing the nicest moccasins I've ever seen. And I ordered a pair from her and, you know, I got them. And then my last day at work in La Ronge, she came in Isla Cross, she came up from Beauval with another pair and said, here's the other pair you wanted. And I had never asked for another pair, but there's no way I was going to turn her down. So, and not only did she give me the moccasins, she had made little doll size leather jacket, you know, like buckskin jacket and pants and moccasins. Yeah, and she said, here you go, you know, this is a gift for you. It was just great.
Oh, that's nice. Wonder who that was.
I don't know. I don't know if you'd know if I showed you the designs, but up here, I've looked in the trading post and I've never seen anything that even comes close to that kind of expertise. So that's been a bit
And
disappointing.
she's from Beauval.
Yes,
What year was that?
Yeah.
1988 to 89. And she was not a youngster, so I don't know if she's still around.
Probably not.
It could be Cecile.
Cecile Bouvier is who you're thinking of too? Yeah. But then 1988 and 89, she wouldn't have been that ancient.
Well, the
Might
mystery
have
goes.
been others.
All right, I'll have to try to remember to bring those for the next meeting so we can share art. And I'd like you all to bring any wonderful clothing you've had made by others. We're not going to talk about medicine anymore.
This is my beadwork.
Oh my goodness, that's your beadwork?
Yeah.
That's
What I'm
gigantic.
working on right now.
Look at that. I've never seen any beadwork like that.
It's in the process.
Okay.
That one's like, it's gonna take me a few months.
Okay, that mystery will solve it. If you show us the design of that beadwork, we'll narrow it down.
Yeah,
Okay.
we'll find out.
Sounds great. It would be nice to know the name of the person who made it. It's such extraordinary work.
Mhm.
Here's some beadwork from this guy's website, Thompson Highway.
Oh, Thompson Highway. I didn't know that Thompson Highway did beadwork.
Who's to say he did? It's just beadwork.
I heard he's written a few things under an alias, Thompson Dirt Road.
He must have been up in Thompson.
Yeah, right. So I'm wondering if there are other questions. I'm enjoying myself immensely, but I don't know how much I'm contributing to the
How about-
community at this point.
Well, let's flip over to Candace if she's got anything to report from her summer activities here. She's been the busy one.
Yeah, I was busy for all of June with fires and evacuations and debriefing meetings with ourselves and MLTC. And what's happening right now is the results from those debriefing meetings are actually pretty positive. We learned a lot during those exercises about which services actually provide good service and which provide so-so service. And we are looking to network with the other First Nations and the Tribal Council to set up teams of people who can do different services. So like registering evacuees and stuff like that. MLTC has taken over transportation, accommodation, and meals. And when Red Cross walked out on us on English River, they took up providing a bit of funding for the evacuees. So registration just was full of gaps and way too slow. Like one of our people didn't get registered for 4 days.
Oh my.
You know, and then they didn't provide enough people to do it. There was no tuck shops, which they had. Like we took training with Red Cross in March.
Oh, you
and they were
did?
telling us all these wonderful things that they do, but they didn't do it.
Well, what did they give you a reason why they didn't do anything?
Oh, well, they were spread too thin. They didn't have enough staff. Like they said they were going to provide 14 staff and they provided 2.
I see.
And their registration process, we actually tried to speed things up by, because we had their forms and stuff, by pre-filling in most of the information. All they had to do basically was needs assessment and then put it into their computer systems. And they just threw out all of the forms.
What?
And started over. So, you know, that cooperation was not very good. And when we tried to speed things along by getting SPSA to help with the registration, Red Cross walked out on us. So
I see. They didn't like you.
It was politics, basically.
Yeah, it was defending their turf, even though they were doing a lousy job.
Right.
Yeah.
And they tried to throw, MLTC under the bus, which didn't fly well because MLTC was doing the majority of the work. Anyway, so we're looking at networking. We're going to be starting to have meetings next month with the other communities, setting up teams, what areas we could provide. We did and so did Buffalo River Dene Nation had more than one evacuation. We had two as well. And
Yes, I remember.
the things we had, like by the second one, we had organized ourselves a lot better, and getting people put into their rooms as soon as they arrived, because we already had people there with the lists, who's going in what room and all of those things. So we were able to mobilize teams, and that's kind of what we want to do. Like if we don't have all the communities in an evacuation situation like we did in June, we want to be able to send people from our other communities to assist. And there's several areas where we can do that. So like we're talking about things like providing tuck shop supplied. So buying wholesale and having it there as needed, because we kind of have an idea now what's needed. One of the biggest issues that came out of those evacuations was, how were people supposed to do laundry? Like they didn't have funds available for that until we got to Hotel Dene in Cold Lake. And they provided coins to use the laundry facilities as people needed it. And that was the most, reasonable situation, basically, that we dealt with.
So what about people? What about people who went to other sites then? What was there ever a solution to that problem?
We had to find money for them. Like MLTC had to give like $75 a piece, because it was like $33 to do 2 loads of laundry.
Oh,
and laundromats these days, it's just ridiculous amount. And so accommodating that and fighting with Red Cross, and like we did get Red Cross back in Cold Lake, and they were telling people, well, you should have brought more clothes, but when you're on a bus, you're supposed to pack light for 3 days only. And then they said, well, you should wash your clothes.
yeah.
Well, yeah, you could if you have funding to do that, but you could use all your funding to wash the clothes. So food was an issue as well. A lot of our elders couldn't handle the restaurant or the catered food for that long. Learning to know what services are available in these different centers ahead of time would be a positive thing. Who to contact. Like I had contact from our meetings last year, still with Pamela Golden McLeod. Yeah, and so I was able to get our evacuees that were in Saskatoon hooked up with some services through her. But knowing what's available in the different communities, and knowing how health services, how to connect with those health services, etc. Those things are important. So as I said, it's been a very big learning curve. Like even getting like our quadriplegic and our paraplegic people transported. MLTC ended up having to pay for the transportation of our quadriplegic person, because EMS wouldn't do it.
Oh my.
And they said, who's paying for it, basically. So rather than mess around, leaving him out like that, and the uncertainty of that, MLTC just paid for it. So I think we got that ironed out, but that's kind of my update on those kind of things. So other than that, we got another fire north of Patchnak right now, and another one northeast of Isla Crosse. And but I don't think that one northeast of Isla Crosse has got anywhere to go. Everything around there is already pretty much burned. And but I've got to watch the winds closely and the weather closely on the one north of Patchnak because it's a fairly big fire and it's crossed over the Frobisher Lake. So we could end up in evacuation again.
Well, I sure hope not, but we'll see.
I sure hope not either. Sending people out the second time was hard. I mean, I was really grateful that they actually agreed to go.
Yeah, yeah.
And like all the communities though had issues with people who have addictions issues and mental health issues and domestic violence, and it was like seeing your community under a microscope in such close quarters. So it was you know, we had to have teams of those kind of people there to help with those things, and I think we could improve on those things going forward. And that's maybe one of the types of teams, like resources that would be available from other communities. So if each community could provide one or two to support a community in evacuation, that might be the way to go.
Mhm. Well, it sounds like you're doing great work with that. It certainly sounds like you've got it much more together than the provincial folks or the Red Cross. I'm astonished.
Well, we had to fight with the SPSA to even get decent information, like to make decisions, you know, when to evacuate and that sort of thing. And at one point we were told when it was within 15 kilometers, if the fire was within 15 kilometers of the community, it was time to go because we had to have enough time to arrange buses. MLTC did an excellent job though by having buses on standby close by. So it didn't take 8 hours to get a bus there. It only took 3, you know. And that was a very good way to go about this. But the next time we had a fire at 6 kilometers from the community, they were saying it wasn't a threat. And that's a community with single road access. So that's, you know, but getting in sufficient information from SPSA, actually, if it wasn't for ISK and NIFA, Patrick Hassler actually pushing SPSA to give us decent information, and MLTC, we had 3 meetings one day to try and get decent information.
Wow.
Because other parts of the north are getting decent information. We weren't. Because Patrick was taking part in all of those meetings with the other communities from the east side and the north side. And it was much more thorough on those areas.
Any idea what caused that discrepancy?
I think they're short-staffed. Like they've made enough cuts. Like I took part in these kind of calls with SPSA back when it was still CERM, Wildfire Management, in 2015, and we had much more thorough communications at that point, and it was nothing like that this time. So
Is that
even like it got to the point too, like they were almost calling me a liar because I said we need that because we have a new subdivision in Patchnak and it didn't have a fire guard, and they said it was done, and it wasn't done. We knew it wasn't done.
Wow.
And they were literally telling me it's done at meetings, and I said it's not. And when your crews get there, I'm having my team take them for a drive and show them. And sure enough, it was not done. It was not a thorough fire guard.
Wow.
So anyway, I learned a lot from ISK as well on the processes and what we need to do going forward, and things we should have known and money we should have had already. Now I'm in the process of writing proposals and getting those monies in place. So
Impressive. I don't know if you would call it that, but I'd say that's a very impressive report, and good for you.
thank you.
I was gonna ask, who was that ISK, emergency response person now? We had a
Michelle Ring.
Michelle Ring, right?
Michelle Ring. She's very good, actually. She's very supportive. I now have 3 years of funding in place that I didn't have. Like, there wasn't even money for my position, really. And we're the only community that has a person in my position. So out of all the Meadow Lake Tribal Council communities, we're the only one with an emergency management coordinator.
Mhm.
So, and we're going to be working towards team building, everybody on the team learning the processes. I'm going to get training for our leadership so they know the processes. The finance people, so they know the processes, because nobody knew how to do anything or what was coverable and what wasn't. One positive thing, remember I had bought air purifiers during COVID.
Yeah.
Because of this evacuation situations. Those work pretty good for people with, I'd say, priority 2s. It works really good for priority 1s, when the smoke is heavy for long durations. Just because their houses can't be sealed, just because there's people going in and out, just because they can't go to the store, those kinds of things, those people needed to go out. And I think going forward, we'll probably do more of our evacuations on a case-by-case basis. Like if they're presenting to the health team that they need, they're having breathing distress or whichever, then they'll be going. But the rest will be staying home with the air purifiers. Those air purifiers, when the smoke was 600 plus on the AQI for 2 days, those were a godsend. All of the team that was left in Pachinak, there were 66 people that were left in Pachinak, to essential services needed to look after the community, know where the pumps are and all those things. They were, without those air purifiers and the air scrubber, they would have been struggling. So those things were really important. So we gotta, thank goodness for we had, we do need to get those in important buildings like clinics. Because we had to put some portable ones into the clinic and it couldn't keep up. And the school wasn't airtight enough and it couldn't keep, like even the big air scrubber couldn't keep up in the gym. So, but we were able to use it in the band hall and that was sufficient in there. So those things are going to be very helpful going forward. And now ISK, like initially ISK wouldn't approve funding for air purifiers in people's homes. But because we are doing it on a loan basis, it gets taken back. It belongs to the band. It gets taken back at the end of the fire season and they get maintained and stored. That way they will cover it. Now, that's just new. So that's going to save a hell of a pile of money in terms of evacuations, because evacuations is, oh my God, that's crazy amount of money that goes into an evacuation expense. Holy.
So did you learn anything in terms of, making a list of, you just talked about some people could stay behind because of the air purifiers and others had to be taken out. Do you now have a pretty good list of who's got to be, what has to be done?
We had both, like, because we got 2 communities. So SHA list, the nurses here make a priority list for me, for my community.
Mm-hmm.
And the Pachinak Clinic makes a priority list. So there's priority 1s and 2s.
Mm-hmm.
The priority 1s are people with asthma, COPD, and cardiac issues.
Mm-hmm.
Priority 2s are children under the age of 5, and minor health issues, like less needy. And those are what we call our chronics, and those are the ones who generally we have dedicated our air purifiers to, with smoke filters. And from my experience here in our community, I only sent out 5 families, and those are people that were COPD, a cancer patient with breathing issues, and a couple of people with severe asthma, and one and 2 people with long COVID.
Mm.
So the rest of the people on my priority list, and there's lots, like, that was the other shocking thing. How many people have got chronic health issues? Lots. There's just way lots. Way more than I expected to see.
Mm.
But all the rest, little babies at all, were able to stay in the community with the air purifiers.
Oh, really? Even little babies? Okay.
Yeah.
And elders as well?
Yeah.
Hmm.
Yeah. So I'm still, our nurses are really busy in Pachinak, but I wanted to get a kind of a report from them as to how many people, because there were some people that refused to leave, elders with major issues, and how many times they saw people who didn't have air purifiers, and how many they didn't see because they had air purifiers. So I'm gonna get a report from them as well. But it was an intense time. 35 days of 18-hour days.
My goodness.
So.
And I'm sure you got huge bonuses.
I'm still waiting. And the thing is, I've told them, like, hey, you gotta pay everybody overtime. Like, a lot of people put in the same kind of hours I did and never had a day off. And all that overtime is recoverable. So that sort of thing.
Well, I can write to the head of the Bank of Canada for you.
And it's my finance people that need to get their butts in here.
Okay.
So
Yeah,
I'm bugging them daily.
Well,
Because we can't do our final report until we get it done either. So
I see. In other locations where I've worked, and in other areas, I've done a lot of training in emergency preparedness and response. And the medical health officer has generally been one of the essential people in this discussion because of the training that we've had and our mandate. But I noticed that during these fires, for the first several days, I wasn't even on the list of people to join the conversation. I wrote a letter to our chief public health officer, Saqib, and I said, Saqib, I don't know what's going on here, but I keep seeing these minutes of meetings that have happened, and I'm never invited, and I don't understand what's going on. So he wrote a letter, and then the next thing you knew, I was on every meeting, and I was asked for my opinion about things. So there's a lot to be worked out at so many levels in our organizations. It's to me, it's a constant source of stress and disappointment.
Yeah, like if Patrick Hessler hadn't been on the calls with SPSA, they wouldn't have considered smoke an issue.
Huh, really?
All they would report on is the fire, where the fire is, and how many air tankers are working. The fact that they were and there was a lot of push from IST and him to say, look, you need help from the feds because you obviously don't have enough. Because at that point, all but 2 communities in the northwest side were evacuated.
Mm-hmm.
You don't have enough resources, human resources. They were recruiting as they were on go. actually, PAGC came up, Sask First Nations Emergency Management out of PA came up and trained 15 level 3 firefighters with a day's notice at Dillon because they were so short over there. And there was fire all around. So, and then there was issues with, if he hadn't been saying, he hadn't been there to answer our community's questions on the smoke and explaining how that works. Like now we all know how it works. If you've got multiple days of smoke at a high enough level, you don't want to leave people there too long, especially those with chronic health issues, and you don't want to return them. Well, I made the decision to return people from Cold Lake and the smoke blew in, but it only blew in for a day. So it was I could have waited one more day, I guess, but.
Well, thank you so much for all that information and for the tremendous work you're doing. It's so impressive. Thanks.
Thank you. I think it kind of shows why we need emergency management coordinators in the communities though. Other communities only had their chiefs and councils who have other duties and they have to spread themselves really thin. Plus it gets pretty political. I had to, quite frankly, put some of my counselors in place in their place and explain to them, no, you can't take people off my team and move them around without telling me because I need them where I need them and that sort of thing. And you can't take equipment out of one community to put in another community and leave that community with no equipment, those kinds of things. Political decisions needed to stay out of the way. So that's one of the things I really have to emphasize.
Well, as the doctor said, a good report there, Candace. It's in your position, I think that's great that you've, I guess, found an anchor in there, but also the regional development. I guess that's, at least we get our foot in the doorway. Chris, if you want to roll into this one, and maybe I know we've talked about federal involvement for funding in that, but I think what we just heard just proves that we're on the right track.
Yeah, I think so.
Yeah.
I just have 2 or 3 comments. One, you said there's a number of reports that are coming out and available. Are those able to be shared?
I don't see why not, but it's reporting to ISK basically that, what funding we've spent and that sort of thing. And then our debriefing reports, like MLTC had its own and our band has its own. And once I haven't finished mine completely because I'm waiting for all of the things to get done at the band level, at the admin level. But as soon as it is, I don't mind sharing it with you at all.
What I'm interested in is when you look at all these reports from a local level, a regional level, and even what is going on at the provincial level, you'll find so many similarities, but the challenge that I see or the forecast is that if people forget fast. And so, you're doing up a report and it's going into ISK, but the problem is the people at ISK don't even understand the actual community enough to even legitimize what it is that your issue you raise as significant. Like, for example, you said these purifiers, how you have to get the band to buy them and then you have to lease them or act like you're leasing them in order to get things because of the way capital monies are identified and spent. And because now you've got all this experience about the problem. It's time to document the design of why the problem exists. I mean, the
Right.
province keeps coming back and saying, hey, the federal government. Well, the province is taking in about $1.2 billion a year just on taxing First Nations, just First Nations. And the province gets transfers from the federal government in the millions. And yet, when it comes down to providing the service, every time you want a program or a project, what the government, provincial government does is say, well, apply to the federal government. So it's almost like the provincial government is double dipping.
Oh,
They're
yeah.
getting,
And I think the feds are onto that now, because now we get to actually review what the province is billing them. And say, well, we didn't receive that service, or this service was not as much, and same thing with Red Cross. Because every time they bill, they also get a 12% admin fee from the feds. So that's how they make their money. And that's why MLTC took it back out of their hands and started doing the transportation, accommodation, and food. And then they get the 12% admin fee. And that's how he bought all these air scrubbers for our communities. Like every one of our communities has air scrubbers, and he had some spares to lend out for other facilities. So we have like 1, 2, 3. We have 3 big air scrubbers between our 2 communities. So like, and those things cost a lot of money, but he paid for it out of the admin fees he got from last year's evacuations. And so it's building that capacity. But when we had the debriefing with ISK and MLTC, that's what they told us. We get to review those expenditures from SPSA and Red Cross, those agencies. So I think they're starting to catch on that they've been getting screwed.
well, what's going to be evident in the next very short term is that the catching on is going to be put into federal legislation on health. And they're talking about having by the fall, October, November, all the engagements, and you've got health directors from each of the bands being engaged, so that there's going to be a draft legislation sometime in the spring. And there's kind of 2 sides to the story. One is that you've got a system that doesn't work, and often people don't know why, and so they deny it doesn't work, or they blame somebody else. And then you've got the second situation where there's no tracked evidence as to why, and that's why I keep suggesting that just putting together an actual identification of how the system is designed and why it's failing would be helpful in the negotiations, because at some point in time, the band leadership is going to have to be at the table negotiating this legislation. And if you don't put your time and effort into it now, what will happen is you'll end up with just more of the same.
Yeah.
So I'm just suggesting that, and that's what I've been talking to Rick about, is that you've got to show people how the system works before you jump to the solutions on them. Because every problem, people have a solution, but often the solutions that are created cause more problems, and nobody tracks the more problems. As you begin to look at the ripple effect of a lot of decisions, whether they're policy, regulation, or just the way things are done. So that's my only comment, Rick. So I'll go back to my eating my wheat thins.
One other comment, we are working on a model, basically, of how emergency management needs to work in our community. So that's like my work for the next year is going to be to develop, because like we were the only community that had a pandemic plan, and that was done before I came on. I don't know how that got done, but it got done. But all of our other plans, like for other emergencies, are incomplete. So like if I hadn't been at certain meetings like these meetings and the Red Cross thing and that sort of thing, I wouldn't have known some of the processes. And so how do you plan if you don't know those processes? So knowing those things and creating a model, that's kind of the expectation now, that we're actually going to build that capacity.
I think there's only one solution, and that's to clone you.
That would be nice. I could take a day off then.
Well, the other good news, I guess, that I found, some people in Alberta, and I think it's around Saddle Lake and Frog Lake area, they heard what we were doing on the onset of the pandemic, and today now their communities has these EMOs in place. And he was asking about Abe Apsis, like these are former hockey players from the past that, they were getting, he was getting an award that day when I met him, but he said, thanks to you guys, we found our way to get into this preparedness and planning. So now each community is putting it together as you are, but then they're putting on a regional, I guess, activation as well. So maybe interprovincial. You mentioned the coordination with Coal Lake.
Yeah.
Maybe reaching out to the other side of it, we don't have to stay within the boundaries of the province for this kind of support. So it might be a federal initiative as, national implications as well.
Who was that?
I'll get the name. I have a record of it. He received an award, but he was from around Frog Lake, Saddle Lake area in that area. But I'll get the name and the location.
Because I know one or two people, but
okay. If I don't have too much to report, guys, as we mentioned before, the education side is a concern looking into the fall here for staffing, and we had trouble staffing in our area, much to the same issues in the medical world, I guess. High cost of energy for teachers, and retaining these teachers to keep working in the north. But training programs, especially highlighting that as well, to keep the TEP program, but also entry level for science and math for the health field. So all these are professional access planning that we need to do at the community level. So Candace, if there's any way we can contingency plan in short order for the fall, maybe that's EMO.
yeah, right. The only thing is our education director is leaving.
Norman?
Yeah. I think he's put in his resignation as of this month already. And they're going to be hiring somebody yet, but I haven't heard of any replacement. So he might still be working, but not for much longer.
Yeah, I'll definitely give him a call. Otherwise, Doctor, any other concerns? Chris has kind of wrapped up the challenge we have in terms of, we've come a long ways in in preparing for the planning for emergencies for the pandemic and all the other issues, but to actuate them and build that legacy that we talked about. I think, Candace, thanks for all your work. It's and persistence. They're
Hey,
hard
that's
work,
got
but
this
it's
model to work from.
the test of patience as well. So with that,
I tried a lot of patience.
we'll close off with a small prayer if everybody's ready to go. I just want to give thanks to our good doctor that has joined us here again, and also think of our colleague Dr. McKinney and her family, and all the young athletes and volunteers and officials that traveled into Halifax. These are medicine games, I call them. A lot of people make relationships and commitments, and the personal hygiene and medicals that takes place with all the nutrition and family support. I think it goes a long way for our young generations to come. So for all the athletes, we give them a prayer for safety on their travels, and may they find their way back home. And we'll talk to you again next week, and may your journeys until then be safe and take care. Distracted driving is dangerous, so Chris, you travel safely. Amen.
Anyway,
Thank you.
You're looking good,
Guys.
doctor. You're TV quality now, man. Well, I'll
well, good
edit
thing you
all the
recorded this one, because I might have to get you to send it to me. I said a lot that I never wrote down.
I like the truth. You guys spoke the truth.
All right. Have a good day, you guys.
Thanks.